we'd first write the patient's name, which I won't do at the moment, the date of birth, and the fact that we've got a female patient, the date of fitting that we're actually going to want the garment for, and whether it's the right or left hand and so forth. But most importantly, although these are the measurements we're asking for, we would like the measuring to actually be done on the other side. So it says, please trace the hand over leaf. Okay, so if you place your hand on there and well up, and then we line the paper up to be comfortable for the patient and that the fingers and the arm are in line, and then we can't really push a big pen between the fingers, so it's as well to use this thin pen. I move the thumb out, and if I'm going to trace vertically around each finger, making sure I'm well into each web space, I'm holding my hand on the patient's hand so that she doesn't move it away, and I do want that little finger in a bit, and here we are. Now sometimes I can't see whether I've actually drawn that, but I'll check when I finish up. So what I'm going to do is I'm going to measure right on the patient. I'm sliding the tape measure under. I'm actually using the centimetre side, and I'm making sure that the end of the tape measure is absolutely on 0 so that I can just overlap it. Here we are, 17.2, and I usually mark on the paper exactly where the tape measure was. And you notice here I'm going absolutely in cross section on the arm. Sorry Christine, I've actually marked you now. But sometimes we do actually make a mark in case we're going further up, and then we can actually mark where it is, for if it goes off the page we can then use the distances on the extended copy. So now to the fingers. I'm going to measure on each of those joints, once again in cross section of the finger, and that is written just beside the area that I've measured, and generally a little line to indicate where. Now I'm going to slide under your entire hand without moving you too much, Christine, thank you. I'm going to measure across what we call the MCP or the knuckle, and here again we just let the tape measure lie comfortably on you, and we put the indication of where you've been measured, and then I'm going to measure each of the fingers just at the base. Now because the fingers are actually on that position, I'm going to write just beside. And I was just wondering whether to make a mark, but I don't really need to because each one is measured at the base, so I'll write it there. And I'll write it there, that's 6.6. Now 9s and 6s, it's usually as well to put a line as to which number it is we're talking about, because that does sometimes look like a 9 even when you're measuring it, but it's a 6. And that is something that matters when I receive it at a distance and have to work out what we're looking at. Okay, if you lift your hand up, we'll see that I have got it all measured and marked. So that is a good hand trace, and I'll be able to make a garment generally to the bed of the fingernails, if that's where you're wanting the fingers to end, or to the end of them if it's a flexion glove. But if you're not particularly wanting it there, you could make the mark as to where you want the fingers to finish, because here we would say finger length full, short. When it says none, it's whether we're just having a gauntlet without the fingers, but it is as well to have measured those fingers, because you'll find that the patient has trouble with it pulling on the thumb if it's just all pivoting on that thumb joint. As the wrist moves, the glove pulls, and we sometimes have to revert to having short fingers because this stabilizes the pull of the glove. If this right hand was unable to go onto the page and was all hunched or damaged, I would actually trace the left hand, if I may, Christine. I would trace the left hand, once again lining that hand up so that it isn't all twisted, because you can see if I get the patient all twisted and I won't get a good indication of the web spaces. And what I'm really looking for is the length of the fingers and the web spaces. You can see I'm going to need to see where the thumb is. So once again, pen's vertical, I'm getting the web spaces. I do have a ring there to go round. and that will give me an indication of the length. Now normally the gloves will go to the nail bed, but for a flexion glove they'll go to the end of the fingers. Now that way I would write on here left hand traced as right, not able to lie flat, perhaps, but that it's the right hand that we need the glove for. So on this side we'd certainly indicate that it was the right hand that we need the glove for, not the left. So that's what we would ask you to do with the tape measure on the centimetres. If the other hand is also unable to lie flat, then you'd need to put something under the paper, and then you're able to actually trace the web spaces and trace the distance between the thumb and the fingers as shown, but once again using the narrow Parker pen to get in, and you can even trace all the way down the arm and get all the measurements that you need taken while the hand is on the page as best you can, although it might be sensible to remove the item underneath once you start measuring. When you've finished tracing and measuring the hand on the other side of the page, you'd then check all the details that you need to hear, which hand we're talking about, whether it's treatment for edema or scar, whether you're wanting a short or a long glove. Generally a short is better, and if you need the length you'd want an arm sleeve separately. Whether the fingers are full, short or none, you've marked on the tracing, and whether the zip is volar or dorsal. And this is usually preferable to be volar, but there may be a reason, as with a flexion glove, that you've got the flexion pad on the palm and therefore the zip will be dorsal. But often we can help you with making the decisions on this situation. Elastic at the end for edema would normally be soft to allow the flow up the arm of the lymph fluids that are being squeezed out, or silicone on the end if it's for scarring between the web spaces, because you're wanting to pull the garment and the fabric down and to hold it down with a sticky elastic, keeping the fabric down between the finger spaces. So that's why the scar would normally have a silicone elastic. If it's flexion, you'd say which fingers, if it's all, or if it's just the one or two fingers. And sometimes you might mention if you're actually wanting flexion for the thumb. The Velcro position, generally it would be around about on the end of the palm, but sometimes people want it higher up so that they can get a really tight pull on the straps. So that's really, if you have those comments. Any other comments are here. And as we've said about tracing the hand overly for if unable to trace an injured hand. But very importantly, if you could show us on this little sketch as to where the injury is on which hand, it helps us, if we're working from a distance, to visualize just what you're dealing with and what you're wanting to treat. So that is a very helpful guide. As to the fabric colour choice, we'd always recommend starting with beige. It has less dye, it's largely natural, 20% cotton in the soft fabric, in the soft lycra, 20% cotton, the rest is elastane. And in the firm, although it's called firm, it is largely 100% elastic. It's not as soft or sleek as that quality, but in fact it's not as tight or as strong as the soft. So the soft is best for edema, for newly healed skin and so forth. The firm is best used for flexion gloves because although it holds, it allows a bit more give for bending as well as holding on to the finger. So generally soft is the best choice in most cases, apart from digi sleeves and flexion gloves. The beige has less dye, the bronze has slightly more, slightly kinder for skin tones. This one tends to go quite light with washing to a creamy pink, whereas the bronze holds to a nice tan colour. The black is not a choice we'd recommend until someone is established in pressure garments, because we found that there's that much more dye in it. It can affect skin even when it's not a scarred skin. It can affect a normal skin with some rubbing and reaction. So we rather establish someone in pressure garments before offering them the black, and they may choose black aesthetically, but we do discourage them from thinking it means they don't need to wash it because it won't show the dirt, because all of these garments require regular washing. We have the wash and care instructions, which tells patients they must always wash their hands before putting the garments on, wash and dry their hands, and then wear the garments only in a dry and fairly clean environment, because picking up dust, dirt or wet actually impairs the use and the elasticity of the fibre, and at the end of a day's use they will have become warm and they will have picked up body fluids and oils, and that will need to be thoroughly flushed out of them with a liquid detergent in a mild temperature, rinsed through with cold water, then towel dried and fresh air dried before putting the garment back on fully dry, because the garment needs time to rest and revive and for the elasticity to be revitalized. Opening the zip, always suggest the patient has elbow resting on the table, that way the hand stays within range. Pull it on very gently, gradually, making sure all 4 fingers are headed for the correct stalls, and advise the patient not to just grab the end and pull, because the whole garment can stretch, and that means that the stress is on the weakest point, which is right there at the slice into the fabric for the fingers to separate. If it's pulled down here, that very often will tear and ladder right at the finger web space. So they just get their fingers in there and then work it on from the outside, generally using the seams to pull it down. Now it looks as if it's wrinkling up because I am pulling it down and it can stretch, but you pull it into place and then you can smooth out the wrinkles. These fingers are full length on me, and therefore I'm only just showing the tips of my fingers, and that is fully on. Then pull the end down to where it should be, and then encourage them to lift the zip well away from themselves so that the piece of fabric left under the zip becomes a lining to keep the zip away from the skin. And then at the last stage you rearrange the elastic around the arm to lift it up, pop it down, and then it has an even, equal hug. The fabric will always move as the hand swivels within its own skin, and although skin can wrinkle, fabric will exaggerate those wrinkles, but in most cases they can be smoothed out, and that's a good fit of a glove. And that's with the zip on the palm, usually easier to do up than on the back of a hand. There's always a concavity in the palm of a hand, which means that the fabric doesn't always make contact with the palm, that always bridges, and therefore there's a bit of space for a zip, whereas at the back of the hand, when the hand is functioning, it actually pulls tight and the skin is very thin, and the zip can sometimes irritate the back of the hand and the back of the wrist. So although you might think it's in the way of using the hand, it's actually less trouble usually on the palm than on the back of the hand. But in the case of a flexion glove, it's generally necessary to put the zip on the back of the hand because the pad is needed to be on the front. It's always worth showing the patient how to take the glove off as well. It's called the donning and the doffing, but here we are. We take the glove off by opening the zip and then easing each finger by the seam up and gradually easing it off, rather than dragging it back on itself, which can cause the seams to pop and also excessive stress on the hand, the injured hand, when you're removing the glove. Not good for the glove or for the patient. So please encourage them to take it off carefully and to care for the glove well.